Doctors are warning parents that a virus typically seen in the wintertime or during cold weather is now spreading this summer. So we bring in Dr. Stan Spinner with Texas Children's Pediatrics and Urgent Care joining me live. Dr. Spinner, always good to have you here on Houston's Morning Show. Tell us, what is the current situation with RSV? That's what we're talking about here. And how surprised are you?
Yeah, so we are very, very surprised to see RSV in these kinds of numbers during the summer. It's really something we've never experienced before. So this virus is a very common respiratory virus that we see every year during the fall and winter months. But in the summer, it is something that rarely is an issue.
So do you have numbers on it right now? You're saying it's unprecedented. I mean, what kind of an increase would you say you're seeing?
Well, I don't have exact numbers because often, we're not testing for it in many of our practices. We monitor for it at the hospital, and we're, getting hundreds of positive cases, but that's just the tip of the iceberg, to represent what's really going through the community. But we're seeing a large number of children presenting to our practices, to our urgent cares, and to our emergency rooms with symptoms that would be consistent with RSV. And again, in cases where they're being tested, we're seeing large numbers of positive cases.
And typically you hear of this in babies or in toddlers, but are you seeing cases in older children as well?
Well, we might be. RSV typically presents as symptoms of a common cold, runny nose, cough, sometimes fever. So for, older children who may develop those kinds of symptoms, they're mild, they go away, and we really don't necessarily know that they're RSV, and usually they wouldn't be tested. It's the younger children, it's the babies under 6 months, the kids under 2 with heart disease or pulmonary disease or other underlying conditions that are at the highest risk of developing the more severe complications.
So, Dr. Spinner, what do you think is behind this surge and in such an off season? I mean, does this have to do with kids gathering again without masks, maybe for the first time? Is our immunity not what it usually is after a year of being masked in schools?
Well, it's a good question. It's a hard answer because we're not really sure. I think a lot of it does have to do with this past, year or, almost year and a half. Our kids were pretty much at home. They weren't around other kids. When they were out, they were wearing masks. So I think that certainly has made a huge difference in the exposure risk from this virus. But why it's come back just now at this time of the year rather than waiting until the next few months, I don't know that anyone has the exact answer to that. But it's something that's there, and when it has a chance to spread, it's taking its advantages.
So, Dr. Spinner, would you typically prescribe an antibiotic for RSV, and most kids, recover within a few days, or kind of walk me through what the treatment is here? Because you mentioned it's like a common cold, right?
Yeah, so RSV, respiratory syncytial virus, that's what it stands for, is a virus. So there are no antibiotics for treating viruses. So essentially, all we can do is really kind of be supportive and treat symptomatically. So for most of the time, we're talking about humidity, saline, help suctioning the nose, acetaminophen or ibuprofen, for fever. It's when RSV causes the more severe complications in our vulnerable population, where it gets down into the bronchial tubes and the lungs, and it can cause what we call bronchiolitis or pneumonia, where the symptoms can become much more severe. That's where we really have the problem. And some of those kids, will require, oxygen. They'll require other forms of therapy to help open up the airways so they can breathe. Many of these children, unfortunately, are going to be hospitalized, and in severe cases, they're put on ventilators. So what we hear about what COVID has done to the lungs of the adults, RSV can do this for the, in our younger children. Again, the good news is that the vast majority do not have those complications. Most who get symptoms, it will go away, within a few days. But there is nothing we could do to cure it, unfortunately, at this point.
Okay, so the takeaway home message here for parents is just really monitor your kids, and if they're having any sort of trouble breathing, I mean, you need to get them to a doctor right away then.
Absolutely. You should certainly notify your physician or get your child to the physician, regardless if it's RSV or other respiratory viruses that could cause the same kinds of symptoms.
Right.
But yes, watch for that. Again, just knowing that the majority of the time your child, if he or she gets RSV, will be fine.
All right. Dr. Spinner with Texas Children's, thanks so much for your time as always. Have a great weekend.
Thank you, Sally. You too. Bye-bye.